In this video, we will learn about all the medical facts about Helicobacter pylori, or H. pylori. In the beginning, we must know what the H. pylori is. We can define it as a bacterium that infects the lining of the stomach and duodenum. It has the potential to affect any age group, even children. Infection with H. pylori is common. About 2/3 of the world's population has it in their bodies. H. pylori is adapted to live in the harsh, acidic environment of the stomach. The H in the name is short for Helicobacter. Helico means spiral, which refers to the shape of the bacteria. This bacterium can change the environment around it and reduce the acidity, so it can survive more easily. The spiral shape of H. pylori allows it to penetrate the stomach lining, where it is protected by mucus, and the body's immune cells cannot reach it. The most common route of H. pylori infection is either oral to oral or fecal to oral contact. The majority of stomach and duodenal ulcers, as well as recurrent dyspepsia, are brought on by H. pylori infection. Long-term H. pylori infection increases the risk of getting stomach cancer. The risk factors for infection include low socio-economic status, unsanitary conditions, and overcrowding. For this reason, infection is more common in the developing countries. Patients with H. pylori infection are typically asymptomatic, but if symptoms do arise, they may include halitosis, which is bad breath, heartburn, nausea, vomiting, diarrhea, stomach or epigastric pain, loss of appetite, unintentional weight loss, and bloating. One of 4 tests can identify H. pylori. The first one is a urea breath test, which relies on the bacteria's capacity to break down urea into ammonia and carbon dioxide. The second test is a stool examination to find antigens in the feces. A blood test to find antibodies in the blood is the third test. The last examination is performed on a biopsy sample obtained during gastroscopy. You should wait at least 2 weeks without using any antibiotics or acid-suppressing medications before getting tested for H. pylori infection. Treatment of H. pylori infection is called triple therapy, as it involves 3 medicines, 2 antibiotics, and an acid-suppressing agent, as proton pump inhibitor or H2 receptor blockers. For complete eradication of H. pylori infection, the course of treatment must be sufficient for at least 2 weeks. Since H. pylori infection was first recognized, doctors have used a variety of medications in double, triple, and quadruple combinations to treat it. Despite those efforts, treatment success is lower than with other infectious diseases. The potassium-competing acid blocker vonoprazan is a recent addition that improves the effectiveness of antibiotic combination therapy. In the end, if you liked this video, do not forget to subscribe to the channel and activate the bell button to receive all new updates. Goodbye.